Good afternoon. Thank you for calling CPAN. This is Krista. How may I help you?
Hi, Krista. I'm calling for some information on starting a medication for a patient of mine.
Great. And may I get your last name?
Sure, it's Doe.
Okay, let me pull up our trait system. It'll just take one brief moment. Okay, Dr. Doe, and may I get your first name?
Sure, it's Jane.
And I see that you're a UTMB provider. Is that correct?
Yes, that's correct.
And let me just verify your email real quickly. It's janedoe@utmb.edu.
Yes, that's correct.
Great. And the patient's date of birth?
2/7/2009.
And is this a female or a male patient?
A female.
Would you like to give us her MRN number?
Sure. It's 245678N.
And this is just to help if you call about this patient again, we'll be able to see any of the calls that you've called about before.
Great, thank you.
And then her insurance?
She has Medicaid.
Do you know which kind? Community Health Choice?
United Healthcare.
United Healthcare. And the patient's zip code?
77565.
Great. And what can we help you with today?
Well, I have a patient in my office, and mom has reported that she has seen cutting marks on the child. I'd like to start the child on medication, but I haven't done that before.
Okay. So it looks like you're looking to get an assessment and some medication management from our psychiatrist. Is that correct?
Yes, that's correct.
Okay, Dr. Doe, let me get a good callback number from you.
Sure, it's 555-555-5555.
Great. I'm going to get in touch with Dr. Trin. She's our psychiatrist on today, and she will be giving you a call back here within the next 30 minutes.
Fantastic. Thank you.
Thank you. Have a wonderful day.
Hello.
Hi, this is Dr. Trin from CPAN.
Hi, Dr. Trin. This is Dr. Doe. Thank you so much for getting back to me.
Of course. How can I help?
So I have a 12-year-old female that came in for a well child yesterday. Her mom mentioned that she caught the child with cutting marks. Mom said the child has mentioned wanting to die before. When I talked to the child alone, she said she's been feeling down for the past few years, even before COVID started. It's gotten worse over the past 2 months. I've already put in a referral for psychiatry, but I wanted to start medications. I just haven't done that before.
I'm so glad you called. Do we know if she's currently suicidal?
She wasn't. She said she thought about it for a few days before. She said that she wanted to use a paper clip to cut herself. I already talked to mom to take away all sharps and medication bottles.
That's good. Do we know if her cutting is linked to any high anxiety triggers? I ask because sometimes kids can use self-harm to cope with anxiety too.
I wasn't able to ask that.
Well, that's okay. Good thing is medication can help with both. So in terms of medications to start, Prozac and Lexapro are the only FDA approved medications for adolescent depression. You can start either, whichever you're more comfortable with. I tend to start with Prozac 10 milligrams daily, but if there's any worry for bipolar symptoms or if there's a family history of bipolar, I usually start Lexapro 5 milligrams daily just because Lexapro has a shorter half-life.
Great. Is there anything I need to tell mom about the medication?
I usually tell the family about the common side effects of GI symptoms like nausea, diarrhea that can happen the first few weeks. I reassure them that it's gonna be better usually afterwards. I also tell them about the black box warning of increased suicidal ideations. I let them know that the risk is low, but it's still possible. And in the study, no one committed suicide.
Thank you. So after they start this medication, when should I see them back?
I usually try to see them back in 3 to 4 weeks. And that way we can see if they tolerate the medication and they may start feeling some improvement by then too. Oh, and let the family know that this medication needs to be taken every day to build up in their body. And the full effect can be seen around 6 to 8 weeks. And then if at follow up, if any issues arise, you can call us back. Do you know if they're seeing a therapist?
Mom said she tried once, but never went.
Okay, so we can send you some therapy resources for cognitive behavioral therapy. The resources have been validated and we can send them to you within 24 hours.
Oh, that would be great. I'm looking forward to that. Okay, so I can start Prozac 10 milligrams or Lexapro 5 milligrams. I'll tell them about the GI side effects and the black box warning.
Yes, exactly. Is there anything else I can help with?
No, I think that was everything. Thank you so much for your time.
You're very welcome. Call back anytime if you need anything.
Great, thank you.